It's my absolute pleasure to introduce you to Dr. Eric Boschmann. We're good friends. We actually today, this year, is our 20th anniversary. We met 20 years ago in 2003. Eric was already a graduate student, a PhD student at Ohio State, and I started in 2003 at Ohio State. So we've known each other for 20 years. Eric graduated with a PhD in geography from Ohio State University in 2008, and then started a tenure-track position at the University of Denver, and that's where he's been ever since. Eric teaches classes on urban geography, urban GIS. He does a lot of things. He's done intro to statistics. He wrote a book on Denver, on the history of Denver, and he taught a class on Denver. On the research side, we've collaborated on a couple of papers on commuting, on job accessibility. More recently, as the title suggests, and you will hear, he focuses on older adults, specifically, more recently, on mobility of older adults. I do want to say that he is an expert both in qualitative and quantitative analysis. So he does mixed methods. He's able to do focus groups and travel surveys, as well as statistics, regressions, and GIS analysis. So he's very adept in both aspects of geographic research. But I think I will stop here and let Eric take on from here. So welcome, Eric.
Thank you. It's very nice to be here, and I want to thank Mike for hosting me, and also to Bush Academy of Sciences for making this possible. We've certainly been talking about this for some time, so it's nice to be here and to speak with you today. I do want to address our friendship real quickly. It's been a pleasure to be a friend of Mike's for the last 20 years. There's a lot of pictures of us. We meet once a year at our annual conference for geographers in the United States. Many years ago, Mike came out to Denver, this one over here, and we, over the course of a week, we did some analysis and set up a framework of a paper that became one of our top papers together that's in the annals of the Association of Geographers. So it's been a pleasure to be a friend, and it's a pleasure to be here with you all today. So what I'd like to do today is talk about some of my recent research on older adults and mobility. As Michael mentioned, some of my earliest research had been on job accessibility and commuting in cities. And over the last 20 to 30 years, 2 or 3 decades, there's been a lot more research, particularly looking at older adults and their transportation needs, and focusing, when we talk about mobility, really focusing on the daily out-of-home routine activities for older adults and the implications of that. So what I'm going to do is just get a very brief background on that literature, and then I want to highlight 3 pieces of research that I've been a part of. Some of it about 10 years old, and some of it very, very recently that's still in review with some journals. So first of all, I'm going to start with a couple of studies that I've done in Denver, Colorado. Denver is a city in the American West, so it's very typical U.S. city that is suburbanized, very low density, residential sprawl, very car oriented, very car dependent. Okay, and it is emblematic or very very typical for the United States. So from that, we kind of extrapolate and talk about what is the status for the United States. Except for New York City, Boston, Washington, D.C., Chicago, San Francisco, which have very good transit systems. Outside of that, it's very car-based. And then a second study, which I just completed, I was able to conduct a survey during COVID to ask older adults about their mobility during COVID. So I want to just give a few highlights on that. And then a very good contrast to Denver is to look at Mexico City. And this is research that my PhD student did for her dissertation. And so I want to highlight some of the findings, particularly that are very contrasting to what we see in Denver. So that's a bit of the outline for for today. So, as I mentioned, over the last 2 or 3 decades, transportation geographers have really been more interested in the mobility of older adults, largely because we know this demographic shift that is happening, where by 2050, our percentage of older adults, persons age 65 and over, is going to double around the world. And so the research has wanted to understand what are the travel behaviors, the routine out-of-home activities that older adults make, and how is it different than the rest of the population? So what are the unique travel behaviors? What are the determinants? What are the variables that affect that mobility, which I'll show some of that today. And a key question often is vulnerability. Who is more vulnerable to unmet basic needs because of travel mobility, or who's more vulnerable to isolation, who's more vulnerable to loneliness or depressed quality of life. And so I'll focus on quality of life a little bit later. There's a whole bunch of policy implications. How do we improve transportation for this? How do we prepare cities to be age-friendly cities for the next several decades? How do we design cities for older adults? And really, this has also been receiving a lot of more popular media attention. And this is from just last week in the New York Times that was asking seniors, older adults, to fill out a survey. Do you have trouble getting around town? And so I'm very anxiously awaiting them to show us their results. So before I dive into the 3 different projects, I want to highlight 2 larger trends that are particularly relevant in the context of car-dependent places like the United States that we're seeing. One is this idea of active aging, where we have very high longevity, people living a very long time past retirement, and also sort of a delayed deterioration of the body. So a lot of many years of active lifestyles, and what that means for older adults, particularly in transportation. So many years ago, The Economist put this cover on their magazine to kind of talk about the new old, the active aging, and then just a couple of months ago, National Geographic did nearly the exact same photograph to show older adults being much more active. The second trend is the concept of aging in place. And this has more to do with residential choice, residential preferences, and the idea of older adults preferring to stay in their home after they retire. So having lived in a home for many decades while raising children and going to work and then retiring, but staying in that home, rather than moving to a retirement home or moving to Florida and Arizona, or downsizing, waiting a few years to downsize. And so this is really particularly significant in a very car-dependent society. So these 2 trends have some implications for transportation and mobility. They're actually quite divergent. On one end, we can talk about older adults driving around a lot for 20 to 30 years after retirement. What are the implications for traffic congestion in cities? What are the implications for sustainability and car emissions, et cetera, for cities as you have more and more of this older adult cohort driving around? On the other hand, in car-dependent societies, what happens when you stop driving? When you reach an age or a point when you can no longer drive and you're stuck in a suburban, car-oriented location, how do you get around and meet your daily needs? Okay, so we'll talk a little bit more about that today. So, the first project I want to talk to you about comes from Denver, Colorado. And again, this is going to be kind of emblematic of the entire United States in many ways. My research on Denver has come in 2 forms, as Mike was alluding to. This first part is going to be more of an analysis of a travel counts data set. So this is a survey that our regional planning organization did of the entire metropolitan area of Denver. From that, I extracted older adults age 60 and above. Retirement age is about 65. So I wanted to get pre-retirement in addition to retirement. So about 4,000 older adults and over 10,000 trips in this data set. A little bit later, I'll do show you some more of the qualitative and survey-based research that I had done. So what I have here on this map of Denver is showing the density, residential location of older adults, and a couple things maybe if my, yeah, there's my pointer. The areas that are in gray and blue, these are the highest density areas. So we definitely see a trend of the more peripheral, the outside, very suburban areas of the city. We're going to contrast this a bit later with Mexico City in particular. And this very high concentration right here, I'm going to show you, this is suburbia. This is a snapshot of suburban location. This is a residential, older adult residential area that was causing that blue area that we saw. But here, this is a very typical suburban location in and around Denver. It's very low density. It's walkable in the sense that there's sidewalks for leisure walking, but not walkable in the sense of walking to the store, getting a gallon of milk and coming back home. So it's very, very car dependent. Okay, there are buses that come maybe every hour, but they're not very frequent, and I'll show a little bit later some trains that have been added. So there's only a couple of metrics that I want to highlight here. So in this quantitative analysis, I wanted to look more at the variations within the cohort of older adults, because some of the earliest literature was trying to look at older adults, how are they different than everyone else? Okay, that tells us one thing, but I wanted to look more at older adults and the variations within that cohort. So as an example, what time of day are trips occurring? Okay, so we have time going from 0 hours to 24 hours on the x-axis. And this is our pre-retirement cohort, 60 to 64-year-olds. So we see at 7 in the morning, there's kind of a peak and then a peak in the afternoon. That's a little bit more representative of what the general working population looks like. But as we increase in age cohort, we start to see a peak where trips are being made, out-of-home trips on a daily basis are being made in the middle part of the day. Okay, so this is one instance of the variation that's occurring within the older age cohort. Okay, and what does this mean for transportation implications, etc.? Another very common metric that's used is simply the number of trips per day. How many trips per day is an individual making, out-of-home trips? There's more going on here in this particular chart. Let's just look at the blue line, which is male, and the red line, which is female. And age is along the bottom. I know it's very difficult to read in this particular output, but we have 60 years old all the way to 90. And we basically are seeing a downward trend in the numbers of trips per day. Okay, that is often the dependent variable in a lot of models that seeks to understand why trips are fewer. Yes, there's a downward trend. Yes, females have a slightly lower than males, but in some models, the relationship of age and number of trips is not significant, oftentimes. So that's often not the most significant determinant of trips. A question that I'll ask later is, even though trips might be declining, are people satisfied? Are individuals feel like they have enough mobility, even though they have fewer trips as things change? So another metric that's often looked at is trip mode, the type of transportation being used. There's a lot of numbers here, so I'm just going to focus our attention on a couple of places. In this data set within Denver, dominated by car. We have those that are dominated by being a driver, and then significantly those that are being driven around in a car as passenger, usually by a spouse or a friend or a relative or someone else. That is the dominant. We do see obviously some differences between males and females in being a passenger, but being a driver is very consistent through the ages until we get down to the oldest age cohort, 85 and above, where driving is cut down to about 50%, a little bit higher. Being a passenger has become much higher. If we look over at other modes, walking, biking, transit just really is not significant in Denver. And this is true through much of the United States, really just not significant. It does increase a little bit for older ages, but this is a context in which people spend their entire lives driving cars, they're not going to all of a sudden take transportation, public transportation, as they retire. And that's one of the big issues that's being faced. Now, Denver has been trying to do some work to overcome the suburban sprawl landscape, land use, in a couple of ways. One is, in the last couple of decades, they have built more light rail through the city. So here we see a picture of the dominant highway and then a light rail that has been built. Our light rail is very centered on downtown into suburbia. Okay, this one happens to be right by the university where I work. And then secondly, around those rail stations to build more transit-oriented development. Mixed use, higher density, walkable areas. In this analysis, I looked at, well, is there a difference in mode usage based on where older adults live? If they live close to one of these transit-oriented developments versus further away. And I think the measure was about a half a mile within that. The one thing from this that was significant that I want to point out is that older adults that did live near one of these transit-oriented developments were more likely or had higher rates of using non-car modes of transportation, probably walking. The question that researchers are asking, is it because of the transit that's available there, or is it the preferences for the amenities in a walkable, mixed-use, higher density neighborhood? And I think it's the latter. So, from this sort of metric analysis, we can say a lot about how this correlates with broader trends across the United States in car-dependent societies. This paper over here was a really good review that was done a number of years ago about cities in US, Canada, Australia, some European cities that are very car-dependent. 90% or more older adults are driving. Very few are using transit. A lot of that has to do with the way that our cities are built in suburbanization. And so one thing that we also see is that older adults today are much more mobile than previous generations of older adults, but their mobility is reduced compared to younger generations. And so again, just the main implication here, the main significant thing is maintaining independence after an individual stops driving. So now within the Denver research, I want to switch more to understanding issues about satisfaction in mobility and quality of life relative to mobility. And because there's been a lot of research that talks about how the ability to leave one's home is central to quality of life, sense of self, sense of belonging, particularly sense of autonomy and independence. And oftentimes it's maybe not necessarily making the trip, but the potential to make a trip, knowing that I could leave the house today versus I feel constrained here. And so there's this quote down here that's very important to my research. Subjective perceptions of mobility are perhaps better predictors of health and well-being than actual metric-based mobility. Okay, so the metrics we're looking at is number of trips per day. Okay, I've done more research that has to collect my own data to ask people, well, how satisfied are you with your mobility on a given day? And so that's what I'm going to focus on a little bit now. I started out, first of all, doing some focus groups, where I collected a bunch of individuals and asked them questions. They were helping me to then design a questionnaire that would go out to a larger audience across the Denver area. These were really fun to do. I'm not going to talk about all of these points, but just highlight a couple of them. And one being that when you conduct a focus group, you want about 6 people or 8 people. But there was so much interest that I got a table full of about 15 people. It was such an important issue. They were happy to talk about it. They were happy to know that someone else was interested in talking about this issue. So this was very relevant to them, and they wanted to talk a lot about it. This particular generation was saying, we don't like to ask for help. We want to be independent. We don't want to be dependent on others. So when we stop driving, that becomes a challenge. Okay? And we talked through different alternative transportation options. They did express their complaints about the public transportation system in Denver and how it's not really designed well for older adults. This organization here called A Little Help coordinates volunteers who will go to someone's home and drive them to their medical appointment, will drive them to the grocery store, will drive them to visit their friend. So they saw that as a very positive alternative form of transportation. So I was able to deploy a survey across the city of Denver and got about 670 surveys back. And so the following results are from that survey. I'm just going to highlight a few of the questions from that survey. This relates to the perceptions of being independent and mobility. The question is, I am freely able to get all the places I need to around Denver. So it's this, whether I agree or not, in being able to get to the places I need. If we focus our attention here, clearly 93% of everyone that I surveyed agreed or strongly agreed that they can freely get to where they're going. This agreement does decline a bit with age, but it's still quite high across the age spectrum. There are some differences between males and females. And then in terms of mobility group, I kind of grouped those that leave their home daily, those that leave their home weekly, and those that leave their home less than weekly, infrequently. Even those infrequent individuals, 80% of them still said, I'm satisfied, or I strongly agree that I'm able to get to where I need to go. Okay, so even though the mobility, that metric, that dependent variable has declined, their satisfaction is still fairly high. Okay. Now, if we tie this to residential location, where people prefer to live and mobility, I asked this question: would you move to a new residential location if it improved the convenience of getting to the places you need? 13% said yes. Most people don't want to move, or the rest were kind of split between no or, well, it depends. Okay, and that's kind of consistent across these different categories. What we know about residential choice is more determined by other factors. Affordability, what are the other amenities that are in that place that a person might live, and this very much relates to what we talked about before, aging in place. Preferring to stay where someone has been living for a very long time, rather than moving somewhere else, okay? And this is very similar to other research I had done on job accessibility, where individuals, how does residential choice determine where people choose to live? So, just to kind of close this out, I was also able to ask people, how long have you lived in your particular residential location? 50% have lived in their home for 20 years or more. So that's really kind of consistent with this aging in place, rather than downsizing or relocating somewhere else. So this was kind of a quick overview of the Denver research that kind of provides us a snapshot of the entire United States, where we talked about aging in place, extreme car dependency, but higher levels of satisfaction of mobility and meeting basic needs, despite mobility declines. So my plan was to take this research in Denver and do it across the United States. I had some money to deploy a survey across the United States and see if these findings are consistent across the United States. Then the pandemic happened. And I was ready to deploy this survey in early 2020, January, February. And we all know the pandemic came on, and I took this screenshot when it said older Americans advised to stay home. They were the first ones to say stay home because of higher levels of vulnerability to the coronavirus. Staying home, well, that's my dependent variable. How many times you leave your home is the dependent variable. So I knew that survey I was planning to do was not going to be viable during the pandemic. But I was able to switch the survey and ask more questions about mobility during the pandemic. And so I'm going to show a few results from it. So clearly we know the pandemic was a major disruption of mobility for all of us, regardless of your age, regardless of where you lived around the world. One thing that was happening, some research that was happening in the United States that talked about general mobility in the US during the pandemic, this wave one, when there was actual lockdowns and restrictions, there was a sharp decline. But that actually really bounced back by June of 2020, okay? And even as wave two, the case numbers increased from June onwards into the fall, mobility kind of stayed, it had rebounded, but not for older adults, because older adults were still very vulnerable and we did not yet have vaccinations. Okay, and so this is when my survey was collected, September of 2020. I deployed the survey across the United States with a company that's able to provide a probability-based survey panel. They do a lot of sort of our political polling in the United States, so they have this panel survey, and it's generalizable to the population. And so I have about 640 some individuals that responded to this survey. Now, given some challenges of conducting research during the pandemic, we all know that when doing research, we need a lot of time to understand the literature. We need time to get some money, write grants. We need time to get approval to do human subjects research. We need time to deploy this. So there's really not a lot of research on older adult mobility during the pandemic. At the top, there's a few studies that were very small, localized surveys or interviews from different locations around the world. A couple of national surveys in the United States. A couple of studies that looked at transit cards, some big data transit for older adults in different cities. Those that had existing longitudinal studies were in a really good position because they already had their panel set up and they'd already been doing some surveys before, and they were able to just deploy a survey during the pandemic. So they were in a good position. So there's really not a lot, but the findings that I found are very consistent with the findings that these papers did find as well. So I want to highlight just a couple of key questions that I asked on this particular survey. Obviously, trips are reduced during the pandemic. So compared to the months before the pandemic, has your daily trip making changed? Let's focus here on the full sample. 60% said yes, whereas 34% said no, but that could be sort of that rebound that some of them had rebounded back to what it had been pre-pandemic. Now, this is expected that there's trip making was reduced, but in September of 2020, still 60% are reduced. We do see some differences between males and females that is statistically significant. And based on income group, the lowest income group showed the biggest difference in terms of either not having reduced their trips or having resumed to about the same. And my survey didn't ask the why question of why this might be. So this is expected, the reduction in trips and some variation by gender and income. Now, the older adult mobility research literature has often asked this question, well, what are the determinants of higher or lower mobility? So we have the dependent variable of number of trips and then all these different social determinants. 7 of them are the most common: age, gender, racial identity, some form of household structure, and in this case I used whether a person lives alone or not, income level, and then whether a person has a disability, and then mode of travel. In this survey, the way that I work with mode of travel, it's either you're a car driver, you're a car passenger, or you use some non-car mode of transportation. When I ran the full model, and I used a negative binomial regression because of the nature of my dependent variable, was highly skewed, it was non-normal and count data, so this, I had to learn this type of regression, but this is the model that I used. Gender, disability, and passenger mode were the significant ones in the full model. So what I did then is ran the model with just those 4 variables. And if we interpret the incidence rate ratio here in the red box, what this tells us is that females had about 23% fewer trips than males. Persons with a disability had about 30% fewer trips than persons without a disability. And then in both cases of persons who are passengers, they had about 50% less or fewer trips than either drivers or non-car users. Okay, so those are some of the most significant determinants of mobility in this study. Now, let's turn to quality of life. Because I deployed my own survey, I was able to ask a lot of questions about quality of life. And again, this is at this point in time, September 2020, older adults still are kind of staying home, not moving about as much. Rate your overall quality of life at this point in time. A couple of things to look at here. If we look at the top 2, 50% are saying quality of life is very good or excellent. And we can add another 37%, 38% saying it's good. Okay, so quality of life is still pretty high, despite living through that pandemic. There is a statistical relationship in terms of the numbers of trips and quality of life. As trips increase per individual, so does quality of life. Now let's look at the bottom one. How has your quality of life changed since the start of the pandemic? Fully 2/3, 66, 67% saying it's about the same. Quality of life is actually still the same as it was before the pandemic, which is very positive to find this. Now let's relate that quality of life and mobility is satisfaction during the pandemic. How satisfied are you with your ability to get to the places you need for daily activities? Again, this is during the pandemic in September. What we see here is about 84% are very satisfied or extremely satisfied. Despite, at this point, it's just self-imposed restrictions of going to grocery store, etc., are satisfied. And again, there's sort of there is a relationship with that satisfaction related to actual trip making. We do see some downward pressure on satisfaction for women, and especially for persons with a disability, and much more difficult to get up, or a higher vulnerability to the coronavirus. So in summary to this particular study, really we saw a couple things that we expected. Trip making was reduced, clearly, that was expected. Also, who was more vulnerable to reduced trip making? Women, persons with disabilities, and car passengers. That was expected, okay, or that wasn't surprising. What was maybe a little bit more surprising was that quality of life remained quite high and satisfaction and mobility remained quite high, despite sort of that lifestyle during the coronavirus. There was a lot of other studies that had looked at quality of life and life satisfaction and mental well-being, not specifically to older adults, but across different cohorts. Who really focused on saying it's the other cohorts. It's persons with young children at home, it's adolescents or youth, health workers, essential workers. Those are the persons that had bigger issues with well-being, higher levels of mental distress or loneliness. Okay, not so much the older adults themselves. So that closes out the second study that I wanted to show some highlights just during the pandemic. Now I want to shift to Mexico City, which provides some good contrasts to what we saw in Denver and across the United States. And this research comes from Jessica Viana Sanchez. She was my PhD student that graduated a year ago, and she took a job as a bilingual mobility planner in Boulder, Colorado. She's fluent in Spanish, and so she provides that bilingual planning help for them. Boulder, Colorado is about 45 minutes north of Denver, Colorado. Okay, and it's where the University of Colorado is located. And so this comes from her dissertation research. And these are the three things that we're going to focus on today. First of all is that a lot of the literature on older adult mobility does not come from the Global South. So asking the question of what research has been done in the Global South. And then she did something similar where she focused on a quantitative analysis of an origin-destination data set that came out of Mexico City with 10,000 older adults in Mexico City. So we'll look at a couple of those results. And then she was able to conduct focus groups and interviews with older adults in Mexico City, where she is from. So the first bit of work that she did was to look at the literature, what is being said about older adults and mobility in the Global South. Because again, much of the research was US and Canada, Europe, and then some East Asia and a lot of Australia. What she was able to find was about 57 relevant papers, which created this literature review that she published last year in the Canadian Geographer. And from that broad set of categories, she narrowed it down to kind of three main themes that these 57 papers were really talking about. The first one had to do with mode choice. So if we kind of look at the left-hand column, this was trip mode choice. A lot of papers focused on that. Really, a lot of the papers were dominated by older adults walking or public transportation. By and large, most of it. Very few that focused on the usage of cars. The middle one is, what are the unmet mobility needs? How is transportation impairing your ability to meet your daily needs? And some of the themes here we're focusing on avoiding public transport due to safety concerns, unreliable service, poor access for frail or disabled riders, buses that aren't equipped for older adults, or unequal access, as we'll see in the Mexico City example. And then finally, the other theme was socioeconomic aspects that intersect with mobility. And so some of these focused on, you know, higher levels of employment of older adults in different cities or different countries, and what that meant for mobility, or the role of intergenerational households that either led to higher levels of mobility or lower levels of mobility. Related to that might be the dynamics of care, domestic care, either being cared for by a younger generation or caring for younger generations such as grandchildren. Okay, and so those dynamics kind of were central to a lot of studies as well. What came out of this is also a need for recognizing a lot of this research is very contextually specific and needing more contextually specific research to understand, well, what's happening here and how is it different than over there. So I wanted to pull out, here's a map of Mexico City. There's sort of the greater Mexico City area, and she focused on more central Mexico City, which is the yellow area. The metro network is kind of in the blue lines. I wanted to pull out a couple socioeconomic characteristics from Mexico City and how they're dramatically different than what I found in Denver and is consistent with the United States. Retirement status. Only 30% of older adults reported being retired in Mexico City, whereas in my survey it was 78% in the United States. So dramatically different, who's working and who's not working. Household composition. In Mexico City, only 13% reported living by themselves, whereas in my survey it was 31%. And car ownership is extremely low. For lower income, it's only about 10% or 11%. For the higher income, it's about 25%, whereas in the United States, it's dominated by cars. That 87% are drivers, and if you're a driver, typically you do own a car. Okay, so some dramatic differences that we see there in the socioeconomic characteristics. So from that origin destination data set, she was able to explore some travel behaviors. Let's actually start here at the bottom in terms of the mode. 40% of the older adults in that origin destination survey use public or some form of shared transport. Right above that is an additional 32% that mainly use walking. Central parts of Mexico City are highly walkable. The bottom 26% are driving. Okay, so that's extremely different than what we found in the United States. Now, if we look at the top table, she was looking at variations and inequalities based on income levels of older adults. So she has these 4 categories of socioeconomic status and how many minutes are spent in travel durations. And there is a significant difference that the lowest income groups are spending quite a bit more time in transport. And a lot of that is to informal work opportunities, whether it's within district, intra-district, or to a different district. Now this is a map that she created in terms of where are trips going for older adults, and we can see a heavy concentration into the central part of the city where there might be jobs or there's a lot of shopping or the medical offices, etc., versus where are the origins of trips that appear to be more from the periphery. Okay, and why this is relevant here is because what she also explored is that in terms of socioeconomics, the periphery is where lower income individuals live, older adults, and the center part of the city is where higher income older adults live. Very different than what we might see in the United States. So she did focus on neighborhood disparities in transportation accessibility. So what he's got going on here, if we focus on in the map there in the middle, she created these, selected some neighborhoods that were high density with older adults, first of all. And then in green, areas that had high accessibility to public transit network, numbers of stops of bus lines or metro lines, versus in the orange, that's more on the periphery. These are high-density, older adult neighborhoods that have low accessibility to public transportation. And this is very much geographically also the residential locations of lower income on the periphery and higher income in the middle. So let's see, she did recognize these spatial differences of high and low accessibility. Geographically, that also correlates with income levels. On this display, she's also looking at different forms of transportation, which I'll show a little bit more on the next slide, and some quotes from her interviews of people's experiences. In terms of work and going to work, lower income residents living on the periphery had much longer commute times to informal jobs. Informal labor is much higher. So they're going from the periphery to some informal job maybe in the center. But residents, older adults living more centrally, are wealthier, more likely to actually be retired, or have a local formal job in the central part of the city. And when she conducted her interviews, she was also able to ask a little bit about the pandemic, and what folks were saying is that they really were only making essential trips, which is true for many people. And in terms of going to work, for low-income, informal workers, they had to make this choice: either lose their job or take the risk of going out on public transportation to go to their job. For higher income individuals that had a car, they just opted to switch to using their car. Okay, car is something they had but didn't always use, but were then switching to the car. So she did a lot of questions and asking preferences based on transportation type. And that's what she's kind of displayed here. The y-axis is sort of least positive perceptions about a mode of transportation to most positive perceptions of mode of transportation. And then this is kind of a quantification of which mode is being used. Down towards the bottom, these two buses are more of the informal modes of transportation that tend to be on the periphery of the city, that might connect people to the formal modes of structured modes of transportation in the city, the subway, the bus rapid transit, and buses. Walking and biking, walking is very significant, but not biking. So a couple of comments from this. In terms of transportation, particularly with these unstructured, less structured, that is less oversight from the government. These are independent drivers. A lot of the riders would talk about bad drivers. They had safety concerns, particularly on these less formal modes. Reckless drivers that were impatient with older adults because, the faster that they can move down the road, the more money they're going to make, so they're not going to wait for older adults. The vehicles are less comfortable, not so much easy to get on and off for older adults. But much more positive opinions for the structured forms of transportation. The subway, the buses, the bus rapid transit, for a lot of reasons. These are subsidized. They're free for older adults. Okay, they're free for older adults. They are much more regular and predictable in their scheduling. They're more comfortable. They're very connected. Easily to connect from one place to the other. You can get to where you want to go. And safer practices for women. Some cars are for women only. So these are some of the things that individuals expressed that their preferences were for those more formal modes of transportation. So this kind of closes out a little bit of an overview of what she found from Mexico City. So to kind of close out this sweeping overview of 3 different studies that I've done here, really one thing is that mobility for older adults is really a consequence of life situation, or what people might call the life course. It's a complexity of factors, okay? And so this leads then to the fact that geographic context really matters, and it's hard to kind of summarize very broadly. So what we've seen here is contextually very different between the United States and Mexico, but also within a single city, the differences between the periphery and the central area. And this has really driven a lot of my research, wanting to see those contextual differences. As Michael alluded to earlier, I like to work with different data sets. Quantitative data sets help us understand some of the metrics, but then we want to ask some questions about perceptions and satisfaction, et cetera, that aren't in those larger data sets. So the power of mixed methods and different data sets leads to this last conclusion about, well, we want to understand the actual metrics of travel behaviors, but we also want to understand how people are satisfied, their perceptions. And this gives us a more complete picture of understanding mobility of older adults. So again, to end with another screenshot, this is an aging world that we're facing, and it's going to be a major topic for the next many decades, and really our cities need to prepare for the transportation needs of older adults. So that's everything I have for today. Thank you very much. A lot of this research has been funded through internal grants at the University of Denver, either for myself or for my PhD student, Jessica. And then again, thanks to the Polish Academy of Sciences for having me here today. It's been a pleasure. Thank you.
Thank you.